Thank you, David, and really excited to be here and to share some of the things that we've been talking about and that we've been working on to this really important issue. And David, very well outlined, like the like the reasons and the impetus behind this project. Next slide. So again, my name is Davis Park. I'm the Vice President at the Front Porch Center for Innovation and Wellbeing. Next slide. And one of the things that David had referred to was the empathy research. And we felt that it was really, really important to understand the needs of the community and where people were coming from and how we can really cater not just the technology, but the approach and the adoption and the training. And this was really important, kind of giving us the insights that was necessary to sort of design this program. And so we engaged in a process of data collection through multiple data points. We collected data sets through the Association of Service Coordinators database, which most affordable housing providers with resident service coordination is required to submit. And we collected information on over 400 residents. And we also conducted our own interviews with residents and with staff. And we did small group technology demonstrations to kind of get a sense as to where people are coming from in terms of their literacy and what their interests and how these kinds of tools can help support their overall independence and their well-being. And because the communities that we're focusing on had multiple languages, it was really important for us to provide these surveys in their native languages. And we had 9 languages that we had these survey tools translated into. And just some very high level findings based on the survey analyses. We found that residents really needed healthcare and digital literacy and access. And this is really, it wasn't really a huge surprise, but it was just validating a lot of the suspicions that we had about people's access to these kinds of services and programs. It also provided us with insights into how we can provide support with regards to mental wellness and mental health, particularly around the context of COVID and the pandemic and social isolation and social distancing. And we also learned relatedly that it was really critical for residents to feel like they needed to have some social connectedness, whether it be with their neighbors or with family members and loved ones, and with staff too. And so there really weren't a huge number of surprisings, but this data collection and the survey process and the interviews and discussions that we had with the community members really supported what we all knew was going on in the community. Next. And so when we looked to see how we can collect data, we looked at 4 primary topic areas. We looked at the environment in terms of safety and security, how people got around, both before and during the pandemic. And we looked at overall health and well-being and how often people saw their physicians, their providers. We asked people about their physical and emotional health, like, how are you doing? Like, what kinds of challenges do you have with respect to vision and hearing and mobility? And we also looked to the topic of technology. What kinds of devices people had, if they had any at all. What kinds of training and support did they receive with the devices that they already had? How do you feel about how technology can help support your day-to-day living and your connections? And we also conducted, as I mentioned, focus groups on devices and got resident feedback on what most resonated with them. And a really important area as well that we were interested was like looking at social connectedness. How often did people see their friends and families and relatives? Um, and to what extent was it on phone calls? Were they visits? And so this kind of helped really build the foundation, looking at these 4 topic areas on the needs of the community, which we wanted to understand in order for us to have these needs really drive the program and the technology. Next. And so some of the findings from the empathy research, uh, again, they weren't tremendously groundbreaking, but it was good to kind of better understand where people were at and where residents were coming from. And the majority of them felt increased feelings of isolation and loneliness during the pandemic. And it has definitely, we found, impacted the residents' environment and their behavior, and led to depression, and how it led to feelings of loneliness. We also have learned that the pandemic also impacted physical conditions as well. People's health were definitely deteriorating. And residents also expressed concerns about falling within their home because they were spending so much more time in their homes. And half of the populations that we had surveyed said that their physical and emotional health were fair or poor, as compared to the pre-pandemic levels. And staff also provided support with helping residents, but there just simply wasn't enough time. And when you're really managing communities that require people to stay at home, it really meant more resources and time to have to serve a population of people who really couldn't come out of their rooms. Next. And so as a result of the insights that we developed through the empathy phase of the project, we learned that there were multilingual communication opportunities. How can we have the resident and the social service coordinators, who are essentially the boots on the ground, connect with their residents? And how can residents communicate with each other as well? One of the findings from the survey was that people really felt a sense of community, and their neighbors and the people around them were really important to their overall well-being. Another opportunity that we learned based on these conversations was that we really need to look at software and devices that supported multiple uses and multiple platforms, whether it's Android, using voice first devices like Alexa and Google. And the opportunity also came up in terms of how people can use technology to use ride sharing services such as Uber and Lyft. And additionally, we learned that education for self-activated care was really important for residents, so that they'd be able to be directed to websites and other online resources in order for them to have access to health plan information and the providers, but also to just simply get education in terms of how they can address some of their health needs. Next. And so what we're doing with Lighthouse, looking towards the future and how we can really help other organizations and providers that do operate affordable housing, is to build a model of sustainability. We felt it was really, really important for us to come up with a very solid plan that's based on testing, that's based on iterations, that would help sustain a program, and not just within Lighthouse, but as we create this model, we want others to be able to take the lessons that we've learned through this project and replicate themselves. And so looking at this approach, it's not just technology based. And one of the things that we've learned over the years, and with these communities as well, is that we can't just say one and done. we really need to build a model sustainability that's going to live in the community. And in order for us to do that, we don't want to just simply focus on a technology. People, the residents that in the communities that we serve really need to have purpose behind why they're using these technologies, what their personal goals, what their personal wellness and health goals are, to really give them a driving force in order for them to use these technologies simply as tools in order for them to get there. And we also learned also from our empathy research phase that ongoing continuous trainings are very, very important. And people need that connection in order for them to learn how to use these tools. And this is an important element in our adoption approach. And to that, there are lots of questions about, well, how do you source this kind of training and support? And we sincerely believe and know that the technology resources, the knowledge base lives in the community. And our intent behind Lighthouse is to leverage that knowledge base and for neighbors to support one another. And we're not looking for people who can hack into NASA or computer engineers, but just through simply learning and engaging with their devices, we really do believe that bringing this feeling and sense of community towards a wellness goal in supporting each other is very viable and doable. But there are some things that there are certain technical issues that we believe will not be able to be handled within the community and their experience and knowledge base. And so we are looking and exploring partnerships that are going to be able to handle some of the more difficult technical support issues that pop out of the community. Next. So while we were in the process of planning and talking about Lighthouse and getting the different elements in place, this was a little bit before Thanksgiving last year, and the governors, and this is a moment when the California was experiencing like a heightened risk level of the pandemic, and infection rates were soaring, and the governor of California had implemented a second round of shutdowns. And this was right around the holidays, and our concerns over social isolation and loneliness just grew. And we felt that it was really critical, though Lighthouse was moving forward, for us to deploy a program in order for us to address this issue and this problem. And so Lighthouse really was in a position and saw this as an opportunity for us to test out some of our initial thinkings and our ideas, and using the lessons that we learned through this first pilot to then help support our overall vision for the project. And so we call this the rapid pilot deployment, or the RPD. Next slide. And the approach that we want to take was, we're in the holidays and we want to make sure that you connect with your friends and families. We know that this season can be very difficult emotionally for some. And it's usually a time when people are connecting with friends and families. And so we wanted to really hone in on a group of residents for this pilot in both communities, at Front Porch and with Eschaton. And we culled the data from our empathy surveys to select a cross-section of residents who had different levels of technology literacy and access through answers that were indicating different levels of social engagement with their neighbors and with friends and families. And we use that empathy data to reach back out to the 20 residents that we wanted to test and pilot this approach with. And even though one of our communities at Front Porch in Los Angeles, Koreatown, was not equipped with broadband access through our community Wi-Fi, which is still in the development stages, we wanted to look to see how we can provide, again, a quick, accessible solution for broadband access. And so we provided 10 MiFi hotspots to some of these residents. And at Eschaton, they did have public Wi-Fi access, and you're going to hear a little bit more from that from the social service coordinator. And so they were essentially ready, and they had somewhat of the infrastructure to bring and introduce the technology to their residents. And the solution that we had selected was a Google Nest Hub, which is a screen-based Google device. And we worked also with a company called Volara to layer a software that's specifically designed for older adults in terms of content and usability and the user experience. And the primary motive and the primary objective of this rapid pilot deployment was social connectedness. And we were very well aware of all of the wonderful things that you can do with a voice-based device, such as the Google Nest Hub Max, which provides also video conferencing, video chat capabilities. But for this short pilot, which started in December and just recently wrapped up in March, we want to focus on social connectedness and helping residents stay connected with friends, their family members, and their care circles.